Hello and welcome to The Print. I am Sumi Sukanya Datta and you are watching Health and You. Many parts in India are currently seeing flu season, and most people who experience flu symptoms seem to have symptoms which last longer and which continues for weeks and even months sometimes. To discuss whether this is just experience of few or doctors too are noticing this, we have with us Dr. GC Khilnani and Dr. Vikas Maurya. Dr. Khilnani has formerly been with the All India Institute of Medical Sciences and currently is the chairman PSRI Institute in Delhi. Dr. Maurya is senior director and head of department pulmonology with Fortis Hospital in Delhi. Thank you for joining us, Dr. Khilnani and Dr. Maurya. So, from you, Dr. Khilnani, we would want to know there was no seasonal flu at all during the peak COVID period, probably due to less or negligible intermingling between people. Has anything about seasonal flu changed after COVID? Also, since most Indian cities also see very high level of pollution nearly throughout the year, does that play a role in how people now experience seasonal flu?
So, Ms. Sumi, thank you very much for having me here. But we need to understand what you call flu is
Mhm.
actually called influenza-like illness.
Right.
What is influenza-like illness is a short period of fever, cough, sore throat, and sometime bringing out sputum, sometime chest tightness. Usually it disappears, as you always say, that if you take antibiotics, it will be cured in 7 days. If you don't take, it will be cured in 1 week.
Mhm.
But several viruses generally cause it. It's always not the influenza that you see, as with the more diagnostic facilities, like if you talk about the world data,
Mhm.
respiratory syncytial virus and rhinoviruses and parainfluenza viruses. These are the three most common viruses. But for a common person, it is called flu. And technically, we call it influenza-like illness.
Right.
So, as you rightly said, during COVID time, when the socialization was not there, travel was not there, flights were not there, everything was in lockdown. So, understandably, the transmission of respiratory infections, be it flu, be it tuberculosis, be it other, went down. Now we are back to the same position as it is. And if you talk about the current situation, it is not only in India. I am aware of all over the world, the viral illnesses are around. Not necessarily influenza. And now with the uh, diagnosis facilities which are enhanced after the COVID, the PCR based and biotechnology based diagnostic facilities are there. So we are diagnosing regularly not only the influenza A and B and parainfluenza, but also HMPV virus, which came into big scare.
Mhm.
Besides the rhinovirus and respiratory syncytial virus, and even coronavirus, not COVID, coronavirus.
Yeah.
So all these viruses cause what is truly called as viral-like illness, which for some reasons, known or unknown, is leading to prolonged cough and prolonged misery. Misery so much so that people complain that for 3 nights they haven't slept at all. They keep coughing, they keep changing antibiotics and keep taking cough syrups, and it doesn't work.
Yeah.
So we'll take the
That's a
discussion
common
further.
complaint that most people have nowadays
Yes,
that
we'll
they have
come to it
cough,
later.
a
How much?
fever, which just
What is the role of air pollution? What is the role of COVID? We'll take it forward as you ask question. This was just a prelude that I
yeah.
wanted.
Dr. Moria, what has your experience been? And also, we have, some questions from our viewers. So I would, there is a viewer who goes by the username of Aditya18893 who wants to know whether, there is another viewer called Ruchita Ghosh who also wants to know whether there is any data that recovery period from flu has changed following COVID, or can it be attributable to the vaccine, or in people seen by COVID, seen in people who have been infected with COVID. So can you also share your experience on these questions?
Yeah, I think first of all, has been rightly said that now we are more aware of the viruses causing it because of the diagnostic facilities Earlier we used to, diagnose only like, influenza virus, flu panel, but after the COVID, now we're having biofire multiplex, testing, and you can test a lot of battery of other, viruses causing respiratory issues. Yes, somehow, yes. I mean, since people have become more and more aware of the after COVID. In COVID, we have all seen how it is affected, and people are affected for a longer period of time. We're talking of long COVID. So yes, people are now again thinking about these symptoms of by caused by current these seasonal viruses, which we have so many types, has already been said by Dr. Kilani, that parainfluenza, rhino, RSV, so many viruses are there. So yes, because but every viruses have their own distinctive pathology, and they causes, some causes more prolonged illness, some causes less. So it's not that we are seeing all patients with that's all patients having symptom longer period of time, but yes, we are seeing more patients coming up with the respiratory viruses, and now they're also more aware. And we all know that the antibiotic doesn't work, and sometimes when it affects your airways as well, you can have bronchitis, which can lead to prolonged post-viral bronchitis, prolonged cough. But yes, many people recover faster, but some people do not recover faster, and it also depends upon their immunity as well, depends upon their comorbidities as well, depend upon their pre-existing illnesses, which may also contribute about their longer perception of symptoms, and also longer symptoms which continues with these viruses. So that is what I would say. Yes, it's not that everybody have longer period of time, but some patient and some people with more sensitivity, they have.
The proportion of people who seem to have longer flu, if I may use the term, in your experience, has it increased over the last 5 years? Has come, if you take into account the COVID period, or
Yeah, I think
people are
somehow.
expecting it more?
Yeah, I think somehow it has. We have seen, because earlier pre-COVID,
So
flu coming up,
Hmm.
seasonal flu, along plus H1N1 virus, which we know that came in 2009, and since then it was coming in this every season, in the spring season and in the winter season as well. Plus we used to see other common cold viruses as well. But now, yes, after COVID, we are seeing more patient coming up with symptoms in which they you start have fever, which goes away, then again have fever and have again more symptoms. So that is what we are seeing at the moment. And but yes, I will saying again that not everybody having such things, but that maybe because of post COVID, or maybe because of immunity, maybe because of their pre-existing illness, they're having such things, or maybe because of the different type of viruses which we are now isolating. Maybe that will be the reason.
Yeah, so Dr. Khilani, there is a lot of anecdotal evidence to it, but what does science say? There are so many different type of viruses, like you said, which can cause influenza-like illnesses. There are influenza A, B, and para-influenza viruses. There are coronaviruses. There are H1N1 viruses, which are there. So do any of these viruses cause probably more sort of moderate or more severe symptoms as compared to others? And also, what is our scientific understanding of it, or is it yet to fully decipher what's going on?
To me, what what is important is to understand that something called bronchial hyperreactivity. That
Mhm,
that if you are exposed to some noxious fumes,
mhm,
you may cough for a minute or two, or another person who has got a tendency to asthma, he'll have a severe attack of asthma. That is one.
mhm,
And is that people whose lung is already affected by some previous illness, which could be asthma, which could be bronchitis, which could be previous tuberculosis, or what is called as interstitial lung disease, or for that matter, any post-COVID. Some people with post had some post-COVID fibrosis, their lung functions were compromised. Now, these are the patients who would react differently to the same viral infection, which another person will get rid of in 7 days' time and will be left with little weakness. So these are the patients, number one, that they can have severe illness, like people who are immunocompromised can have a severe pneumonia, which can sometimes even be fatal. They can go on a ventilator. Same virus, with the same virus. But the other thing that one is worried about, as because it affects the masses, that those whose respiratory system is hyperreactive, it could be because of the bad air quality and air pollution with which there's airway inflammation. It could be because of the underlying illnesses that their system reacts differently to the same virus. Now, what it leads to in asthmatic patient, it may give rise to a severe attack of asthma, which
Mm-hmm.
requires bronchodilators and nebulization. More often than not, what we are seeing is that these patients get a intractable cough. They keep coughing without bringing out much sputum. With that, their chest pain occurs because of the violent coughing, and it goes on for 3 weeks, 4 weeks, 5 weeks, 6 weeks. What is important to know that these people keep gulping courses of antibiotic. One antibiotic course, then second they go to third doctor, third antibiotic course. It is important to investigate them. You more often than not, their X-rays would be normal. They will not have any blood investigation which are abnormal. It is important to understand that in my experience, what I have done in my practice, that I do their lung functions, what is called as spirometry. Some of them have actually bronchospasm, that is, their bronchial tubes are narrowed. But there is a test called fraction of exhaled nitric oxide, which called FeNO, which measures the airway inflammation. And that is increased in so many patients, especially in response to air pollution also, which I have been doing it for years together. You might know that's my research area.
Yeah, absolutely.
Somehow these patients sometimes respond to small dosages of systemic steroids. I am not subscribing that steroids should be taken indiscriminately. It should be taken by only prescribed by only the
Physicians, treating doctors.
medical practitioner, and it should be given judiciously, understanding the contraindication that it actually disturbs the sugars and blood pressure and so on and so forth. A short course of systemic steroid is sometimes necessary. More often than not, it is the inhaled treatment which does the magic. So we more depend on inhaled uh, drugs so that they have minimum side effects, and reassuring the patient that it's of no consequence, because one is worried. They keep reading the वो स्टिकर्स एंड वॉलपेपर कि आपको 3 हफ्ते से ज्यादा की खांसी है, तो अब तो 2 कहते हैं, 2 हफ्ते से ज्यादा की खांसी है तो टीबी हो सकती है, निमोनिया हो सकता है, blah blah blah. So therefore it is important to understand by investigation and by your clinical examination that it is a post-viral cough. Assure them that they should hydrate themselves well, avoid taking spicy and chili food, and whatever hurts your. And one thing I have seen in my experience, I'm not talking from the book, that those who are severely affected, I advise them to for a week or so go on a total bland diet. That means avoid anything which hurts your stomach, like excess of coffee or chili food or chutneys and chilled food. That I've seen does help. These small things would help, and reassurance will go a long way. But keep your eyes open. If you think every patient with a cough should is post-viral cough, you might be missing some diseases. So it is important to, if the cough has gone long for more than 3 weeks, to do at least an X-ray test and rule out other conditions. Thank
Yeah. So very important messages there, but we know from our experience that there are certain measures that can help prevent flu for all of us. That includes keeping away from people who are infected, wearing mask when we can. But there is also one element, one intervention, preventive intervention that many people even don't even know about, and that is flu shot. In the West, there is a huge acceptance and demand for flu shots, but in India, not so much. Dr. Moria, what do you say about taking flu shots? How effective are they, and who should go for it, Dr. Moria?
Yeah, I think it's a very good the question. Obviously, taking precautions is important as much as we can. like hand hygiene, mask usage of mask and avoiding crowd. And obviously, I always advise, my patients, specifically, those who have risk factors, those who have some chronic pre-existing diseases, or maybe, diabetes, having chronic lung disease or kidney disease, or some other, chronic organ involvement, or immunodeficient patients. So these patients, plus, the elderly more than 60 years of age, and the children, so they are more prone for these recurrent respiratory infections. So they are usually advised. Plus, any patient coming to me in my OPD and all this, after taking proper history and examination. So we do advise them flu shots as well. So my all chronic patients, they always get flu shots every year. So that is what we advise, and but I advise them to take it before arrival of the winter, at least 1 month before that, because the efficacy, if we consider the efficacy of you cannot have 100% efficacy.
Mm-hmm. So I was coming to that. In fact, so what is the rate of efficacy would you say that we see in the Indian context?
See, it has been around 60 to 70%, which is said in many of the literatures in Indian context. But and also, if you know, in COVID also, when these vaccines were given, I just give an example that we were saying that even the data was said it's not, it will not prevent you infection. Maybe you may get infection with maybe asymptomatic or maybe milder form of the disease. Similarly, when we're getting these viral vaccines, because the virus changes over time, and so you're making new vaccine, new strains for the vaccine with newer strains. So you may achieve 60 to 70%, but yes, in some patients they may get infection, but that may be asymptomatic or maybe milder form of the disease. But I have seen that those who get flu shots, at an appropriate time of the year, they usually get maybe asymptomatic or the milder form of the disease, but not the severe form of the disease, or maybe the moderate form of the disease. So that's what we have seen. So that's why we recommend in all the patients, and all these risk patients with having such risk factors, so these should be recommended.
Okay. Dr. Khilnani, what is your experience with the flu vaccines, and do you recommend this for your patients? Also, there is a related question. One reason why not many people take it is because it's not available through the government program, the universal immunization program. Adult vaccination largely is not, except for some vaccines for pregnant women. So, do you think probably, the government should also consider this?
So there are two vaccines which are used for prevention of respiratory diseases besides, of course, tuberculosis. One is flu vaccine, another is pneumonia vaccine. So since
Okay.
you have asked particular about flu vaccine, so we need to understand what is flu vaccine and where does it come from. So there are two. One is southern hemisphere strain.
Yeah, and the other is northern hemisphere.
Northern, because the flu virus. Now this flu virus is notorious for mutations, like COVID virus. So when the southern vaccine comes, this will have a particular, that vaccine will contain particular strain of viruses. And northern vaccine will contain particular strain of viruses. Now one has to understand that it will protect against only those strains which are present in that particular vaccine. Now, the criticism of that vaccine, now I'm talking a little bit of science, that at given point of time, what strains are going around in India is usually not identified, not known. That is why people say कि अरे मैंने तो वैक्सीन लगाया फिर मेरे को फ्लू हो गया तो फिर क्या फायदा हुआ. So as Dr. Moria said, the severity goes down, but one has to understand that it does not give 100% protection. But one should understand that, like, it is not put it as a national program because it is a question of cost. So it has been recommended by all the societies, all the expert committees, that flu vaccine should be taken by those who are more than 60 years, or those who have chronic respiratory illness, or they have diabetes, or they are immunocompromised, or any other disease, or those who have undergone in spleen. Let me not go into that. It is not all healthcare workers, whether they are doctors or nurses or orderlies or working in the hospitals. In US, if the healthcare worker is not vaccinated, he will not be allowed to go into the hospital. It's as much as that. But in India, it is not yet come. So therefore, even if you do mass vaccination, it will not prevent all viral infections like, as I said, rhinovirus, respiratory syncytial virus, and HMPV virus, coronaviruses. All these viruses will not be protected. So nobody should think that a flu shot will prevent. I'm not against that. But there is a, as of now in India, there is a section of people who are candidates for flu vaccine. They are pretty expensive also, so it is not possible to give it to all of the masses. But it is also true that anybody who wants to be protected, if somebody is 25 years old and is otherwise healthy, if he wishes to take, there's nothing stopping it. It doesn't cause any harm. It is quite safe. It doesn't have any side effects, but it's not part of the mass vaccination. Pneumonia vaccine is a different ball game altogether. It is against a particular bacteria called Streptococcus pneumoniae, and that we are not talking about today. So,
Yeah, yeah. That's really helpful, sir. I am sure our viewers will immensely benefit from this conversation. With that, we wrap up this discussion. Really appreciate that both of you could take out time and join us today. Thank you so much, Dr. Killani and Dr. Maurya. Thanks.
Yeah, thank you. Thanks for having me.